Kidney stones are very common, and there are basically stones that form within the kidneys and can either stay there or get lodged in the urinary tract as they're trying to pass out. The main symptom of kidney stones is flank pain, and most people describe it as the worst pain they've ever had. They're very common, and there is a family history of it. So if somebody in your family has kidney stones, you're more likely to get it than the average person. So the treatment of kidney stones depends on several things. It depends on the type of the stone, the size of the stone, and the location of the stone. Usually we try to do the least invasive treatment first. If we know that a patient has uric acid stones, that would be giving medication to try to dissolve the stone. If the patient has a stone in the kidney that's not too large, then we can use what's called extracorporeal shockwave lithotripsy, which is commonly referred to as blasting the stone. That's a procedure where a shock wave is generated outside the body, sort of within a water balloon that's pushed against your flank. Stones which are not amenable to shockwave lithotripsy or being dissolved with medicine can be removed in a couple different ways. One way is to look into the urethra and bladder and put a telescope all the way up to where the stone is, and if the stone is small enough, grab it with a basket and pull it out, and if it's not small enough, to use a laser fiber to break it up into smaller pieces. Patients who have large stones in the kidney are in a situation where that's more difficult to treat. That sometimes is treated by putting a telescope through the back into the kidney, breaking up the stones and pulling out the pieces. The good news is that kidney stones are treatable, and most importantly, they're preventable. So if you get a stone once, you should definitely have the tests done to try and find out what caused the stone so that you can take specific preventative measures in the future.